Greetings to doctors and all my fellow friends. My name is Marlinda Augustine, and today I will be presenting about the specialty that I choose, which is the obstetrics and gynecology. So first, I will be talking about the specialist in obstetrics and gynecology that had inspired me a lot. The specialist is Professor Dr. Wu Yinling. Professor Dr. Wu Yinling is a consultant gynecological oncologist at University Malaya Medical Center UUMC, and she is the co-founder of program ROSE, which stands for Removing Obstacles to Cervical Screening. She is also the recipient of the 2023 Rachel Pielin Award, which is a global award for cancer research. She is a recognized expert in HPV vaccination, and Professor Dr. Wu Yinling is also dedicated to making cervical cancer prevention accessible and affordable, especially in low-income families in our country. And now, moving on to the anatomy of the female reproductive system. There are 5 key structures that I would like to highlight in the anatomy of the female reproductive system, which is the uterine tube, uterus, cervix, vagina, and also ovary. And now, let's first talk about the ovaries. The ovaries are a paired oval organs attached to the posterior surface of the broad ligament of the uterus by the mesovarium. The ovary will produce eggs and female sex hormones like estrogen and progesterone. And now let's see the uterine tubes. The uterine tubes, also known as the fallopian tubes, it is the muscular tubes found in the female reproductive tract. Uterine tubes functions as the passageway for eggs from the ovaries to the uterus and provides the site for fertilization by the sperm. And now we have the uterus, where a fertilized egg will implant and grows into fetus during pregnancy. Uterus is a thick-walled muscular organ capable of expansion to accommodate a growing fetus. And let's talk about the vagina. The vagina is a fibromuscular tube with anterior and also posterior walls. The function of vagina is to receive the penis during sexual reproduction, allows the menstrual blood to exit the body, and also lets the baby passes through during childbirth. And last but not least, we also had the cervix, which allows menstrual blood to flow from the uterus and serve as a pathway for sperms to enter the uterus. And now I will be explaining about the biochemistry and also physiological of female reproductive system, which involve the stages of the menstrual cycle. So there are 5 key hormones in these stages of the menstrual cycle, which is the follicle stimulating hormone, FSH, which stimulates follicle growth in the ovaries. And we also have the gonadotrophin releasing hormone, GnRH, which triggers ovulation and stimulates corpus luteum formation. Next, we also have the luteinizing hormone, LH, that triggers ovulation and stimulates corpus luteum formation. And we also have the estrogen, which regulates the growth of the uterine lining for potential pregnancy. And lastly, we have the progesterone, which maintains the uterine lining for potential pregnancy. So there are 4 phases of the menstrual cycle, which is the menstrual phase, follicular phase, ovulation, and also luteal phase. So during the first phase, which is menstrual phase, that occurs between day 1 until day 5, the menstruations begins, and if pregnancy does not occur, the thickened uterine lining is shed. The estrogen level and progesterone level are low, and the uterine lining breaks down and is expelled as menstrual blood. Next is the follicular phase, which happens during day 1 until 13. And this phase overlaps with the menstrual cycle. The hypothalamus will release GnRH to stimulate the pituitary gland to release FSH. The FSH then will stimulate several ovarian follicles to mature, each containing an egg. and as follicles mature, they secrete estrogen to help rebuild and thicken the uterine lining. And day 14 is where the ovulation occurs. Estrogen level peaks, which triggers a surge in LH, and this surge of LH will cause the dominant follicle to rupture and release a mature egg from the ovary into the fallopian tube. Ovulation occurs and the egg is now available for fertilization. The last phase is the luteal phase, which occurs during day 15 until day 28. After ovulation, the ruptured follicle will transform into corpus luteum, which secretes progesterone. And if fertilization does not occur, the corpus luteum will degenerate, leading to a drop in progesterone and estrogen level. This low level of estrogen and progesterone will trigger the breakdown of the uterine lining, resulting in menstruation, and the phase will begin all over again. Next, I will be discussing about the disease that related in obstetrics and gynecology, which is the uterine cancer. Uterine cancer occurs when abnormal cells develop in the uterus and begin growing rapidly and uncontrollably. There are two types of uterine cancer, which is endometrial cancer. It is more common and it develops in the inner lining of the uterus, while the uterine sarcoma, which is more rare, it develops in the myometrium, which is the muscle wall of the uterus. The symptoms of uterine cancer can involve vaginal bleeding between periods before menopause, vaginal bleeding or spotting after menopause, lower abdominal pain, difficulty in urinating, and also extreme weight loss. So the risk factor of uterine cancer is age, where the likelihood of developing uterine cancer will increase as age increases. Diet also involved in risk factors of uterine cancer, where a high-fat diet can increase the risk of uterine cancer. And last but not least, family history, which can be inherited genetic disorders that can increase cancer risk. There are 4 stages of the uterine cancer, which is stage 1, stage 2, stage 3, and stage 4. During stage 1, the cancer has not spread beyond the uterus. In stage 2, the cancer has spread to the cervix. In stage 3, the cancer has spread to the vagina, ovaries, or lymph nodes. And the last stage, which is the 4th stage, the cancer has spread to other organs that far away from the uterus, such as the bladder. Nowadays, due to the development of modern technology, we have some advanced technology in obstetrics and gynecology that can really help in diagnosing and also solving problems. The first one is ultrasound. Ultrasound in obstetrics and gynecology is used to look inside the uterus and monitor pregnancy. It helps doctors to confirm pregnancy, check the growth and heartbeat of the fetus, assess the placenta and amniotic fluid, detect abnormalities, and also examine the uterus and ovaries. It is safe, non-invasive, and provides a real-time image. And we also have hysteroscopy. Hysteroscopy is a minimally invasive procedure that allows direct visualization of the uterine cavity using a thin, lighted instrument with a small camera called a hysteroscope, which is inserted through the vagina and cervix. It enables clinicians or doctors to assess and treat conditions such as uterine polyps, fibroids, abnormal bleeding, and also uterine abnormalities. The procedure provides real-time image. To conclude my presentation, obstetrics and gynecology is a medical specialty that focuses on the care of women's reproductive health across stages of life, from adolescence to pregnancy, childbirth, and also menopause. So that is all for me, and I hope this presentation can be beneficial and informative to all of us. Thank you so much.